Welcome, everyone, to our talk on thyroid health. Let's go ahead and get started with the presentation. So we're going to talk about how to fix your thyroid. And for most of you, you may understand that the thyroid lives sort of at the base of our neck and it controls a lot of things. So how many of you here attending tonight understand simple things like what the thyroid does, how it affects our health, what goes wrong, and what symptoms should you be looking for? So in the chat, how many of you knew that losing the edges of your eyebrows is a sign of thyroid disease? Isn't that interesting? So I find that a lot of times we are unaware of the fact that these simple things can be a sign of thyroid problems. Now, there are some other things here that can be affecting you. So low thyroid function or high thyroid function. The thyroid regulates our metabolism. When our thyroid isn't functioning, our metabolism slows down. And if our thyroid is hyperfunctioning, our metabolism speeds up. So you can experience with a slower metabolism, weight gain, dry hair, dry skin, brittle nails, constipation. How many of us have chronic constipation, right? So it's really an interesting thing that we sometimes don't realize that these symptoms can be related to your thyroid. Now, on the other side, if your thyroid is overproducing thyroid hormone, then it can really cause your metabolism to speed up. It can cause you weight loss, insomnia, diarrhea, sweating, anxiety, nervousness, irritability. So it's really important to understand that your symptoms may be related to the thyroid. For those of you who are joining me on the call and watching tonight, I want you to do a little exercise with me. Most people are not aware of how to find their thyroid. So start by placing your hand at the base of your neck, okay? So at the base of your throat. And then find your windpipe, okay? Your windpipe is right in the center. Now slide your fingers down the windpipe until you get to the base of your neck. Your thyroid gland sits on either side of your windpipe. So if you push from side to side, you might be able to feel your thyroid gland. So that's how your doctor will check during your exam to see if your thyroid is enlarged, if you have nodules, if it feels asymmetric, if it's tender to touch. So this is a common exam that your doctor may do. You go to the doctor and you say, you know what, I'm having a problem with hair loss. I'm tired all the time. I'm constipated. I wonder if it's my thyroid. So what's the first thing that your doctor will order for you? It's a blood test called a TSH. How many of you have heard of the TSH or had a TSH drawn, right? For those of you who are not familiar with the TSH, I just have a simple explanation. The brain tells the thyroid to make hormone. That signal is called a TSH. So if you're not making enough thyroid hormone, the brain will increase the signal, right? So look at the diagram. That hypothyroidism causes the TSH to go above 4.5. But if you're making too much thyroid hormone, the brain is going to lower the signal. So you're going to get a low TSH. A lot of people get that mixed up. A low TSH doesn't mean low thyroid function. It means the opposite, okay? So a low TSH means that you are making too much hormone. A high TSH means you're making not enough hormone, okay? So now you go to your doctor, they order a TSH, they say your TSH is off. What happens? How many of you just get prescribed a medication? No further inquiry, no further testing, no further looking into why the TSH is abnormal. This is a common problem. So here's a myth. Thyroid disease is easy to diagnose with simple blood tests like a TSH. It's not true. Oftentimes, thyroid disease gets missed because the TSH may be normal, right? So it's important to get not just the TSH as a screening tool, but also look at the free T3, free T4, thyroid antibodies, and very importantly, something called a reverse T3. And you don't have to memorize all this. I'll provide it to you in a handout after the webinar, and I'm going to walk you through it and make it so simple for you to understand. Another myth. Tell me in the chat if you've heard this, right? If your TSH is normal, your symptoms aren't related to your thyroid. Unfortunately, that too is not true, okay? Oftentimes when you have a normal TSH, it may be just the beginnings of having a thyroid problem. And so here is where you need to have more tests done. If you are sick, if you've been in the hospital, if you've been in the ICU, and you've had problems with your thyroid, your TSH may show up as being normal, but when they check a T3 or reverse T3, they'll find out that it is related to the thyroid. Okay, so getting additional testing is so important. Now, another reason why it gets missed is the brain is the cause of the low thyroid. You're not sending a signal. And so we have to make sure that you are checking for all thyroid hormones, okay? Because it might be a brain issue where the low TSH is causing the thyroid not to function properly. So today we're going to talk about how you can increase your thyroid production, thyroid hormone production, how you can then activate that thyroid into its active form, and how you can improve the thyroid hormone from entering your cell. The 3 reasons why your thyroid might not be functioning properly. So, in order to understand how to increase your thyroid production, we have to understand what makes our thyroid work. So, for those of you who are watching tonight in the chat, take a look at this. The nutrients that your thyroid needs to make thyroid hormone include tyrosine, which makes the T in thyroid, iodine, which makes the 4 iodines, making the T4. But it requires zinc and selenium to add those iodines onto the T. All right, so we need these Lego building blocks in order to make thyroid hormone. So in the chat, how many of you know what's the number 1 cause of low thyroid disease in the non-Western world? What nutrient is related to not making enough thyroid hormone? Let me know if you know the answer. So we know that there are several nutrients that are important, right? Tyrosine, iodine. So iodine deficiency is the number 1 cause of low thyroid function in the non-Western world, okay? It's required. Iodine makes up the 4 iodines in T4. And so oftentimes when people have a TSH that's elevated, they're put on thyroid hormone for the rest of their life. The root cause is never identified. But what if your thyroid problem is caused by a simple nutrient deficiency? And just by replacing that nutrient, you can restore healthy thyroid function. Isn't that amazing? So it's important to not just get that TSH, but get your free T4 checked and get these specific nutrients checked. Now, once your thyroid makes the thyroid hormone we call T4, how many guys have heard of this myth? Broccoli and crucifers interfere with my thyroid. My doctor says I can't eat them. Or soy interferes with my thyroid. I can't have it. That is a very common myth. Now, let me tell you the science behind it. Broccoli and other cruciferous vegetables like cauliflower, kale, Brussels sprouts, they do make a compound called goitrogens, which interferes with the thyroid being able to take up iodine. But guys, you would have to eat several cups of raw broccoli every day for it to affect your thyroid hormone. And if you cook, steam, boil, grill, bake your broccoli, you actually reduce these goitrogens. And soy does have some isoflavones, which can interfere with the production of your thyroid production. But again, small doses does not interfere. Taking it over a period of time, not eating a ton of soy all at once, not taking it around the time of your medication, all of that stuff can help you continue to eat healthfully in balance without it interfering with your health. Now, you've just made T4. You've used all those wonderful nutrients to make this T4 happen. But in order for your cells to use thyroid hormone, it has to activate it to T3, okay? So now, what happens if you cannot convert T4 to T3? You're low on thyroid. Your cells aren't receiving the signal because you need the T3 to actually activate the cell, right? So if you are planning on just taking T4 as a replacement, like your doctor has prescribed Synthroid, like a lot of us take, including myself, and you're deficient in zinc and selenium, and you haven't checked a free T3, you might still have hair loss, fatigue, weight gain, constipation, joint pain, achiness, depression, and go, why am I not feeling any better? I'm taking my medication. It could be that you're not converting it to its active form called T3. So checking zinc and selenium and a free T3 level can help you decipher the reasons why you're not feeling better on your medication. So now, once you activate the thyroid medication, now you've just converted T4 with 4 iodines to T3 with 3 iodines in the liver using zinc and selenium. But that T3 has to attach to the cell to go inside to do its work. But what if the door doesn't open and the T3 is outside the cell and it can't go in? Well, that receptor binding of T3 on the cell is dependent on vitamin A, zinc, and exercise. So again, if you're nutrient deficient, your blood levels could look normal, but you don't feel any better because even though all that hormone in the bloodstream meets the lab standards, it's not going inside the cell. Another reason why checking your nutrient levels and checking free T3, free T4, TSH is essential. So tell me in the chat, have any of you had your levels look normal, but you still don't feel better? Happens often. Here's another myth, but listen, taking more T4 may not be the solution. You may have trouble converting T4 to T3. You may be taking calcium and magnesium, which is binding with the absorption of your medication. You might be taking antacids, acid blockers, TUMS, which are interfering with the absorption of your thyroid medication. How many of you guys know this? Tell me in the chat that coffee interferes with the absorption of your thyroid medication. Let me know. I mean, there's a lot of, oh my God, really? Because we don't realize that you need to take your thyroid medication on an empty stomach. And you need to wait half an hour to an hour before you eat, drink, or take any other medications or supplements because this medication is very sensitive. Having a high fiber breakfast can decrease the absorption of your medication. Having soy with your thyroid medication can decrease the absorption of it. Now, another major reason why the medication's not working properly can be because you're getting multiple different generics every time you go to the pharmacy. I'm a big fan of taking branded thyroid medication because it's the same company making the same formula and you're getting the same amount. But if it's not available to you, fair enough. But I would invite you to consider taking the same brand each time, taking it at the same time in the same way to make sure that you're not having problems with interference. And one other reason why you might be tired is though you're taking T4, the thyroid medication, because you're stressed, because you're sick, because maybe you're intermittent fasting, the body will naturally take that thyroid hormone and put it in storage because it doesn't want you to speed up your metabolism if you're stressed, if you're sick, or if you're starving. So you want to check for something called a reverse T3. That's the storage form of thyroid. The body will just squirrel it away because you're not feeling good. So you might be tired, sick, post-COVID syndrome and feel like, why am I not getting enough energy? It could be that the body is pushing all your thyroid hormone into the storage form, and you can check for that using reverse T3. Mary, you're saying generic doesn't work for you, name brand only works for you. I agree. I'm in the same boat. I was diagnosed with thyroid cancer when I was 29. I had my thyroid removed for the last 20 plus years. I've had to take thyroid medication. And, again, I found that whenever I switch to generic, I just don't feel the same. So I do take a branded version of it. Here's another myth that comes up. A lot of women will come into the clinic and they want to lose weight and they're hoping they have a thyroid problem so that once they're in thyroid medication, they'll start to lose a ton of weight. And again, that's a myth. Just taking a thyroid pill isn't going to address the weight issue, right? So oftentimes I work with my patients to have a full comprehensive lifestyle approach to nutrition, to exercise, stress reduction, reducing environmental toxins. And if they still think that there may be a thyroid problem, then I look at the steps of how a thyroid hormone works from the production to the conversion to its active form to the absorption into the cell. and everything that could be potentially hindering your medication from working. So always treat the root cause, right? So if you do get a micronutrient test and you see that you're deficient in nutrients that might be hindering your thyroid function, first start with food. And I have a list here for you. Again, put this on your shopping list. Maybe you want to address these 4 things if you are low on thyroid. Make sure you're eating foods rich in iron, or you always add in some cashews or pumpkin seeds into your salad for the zinc. Or maybe you start your morning with eggs in the morning, which can help you with the selenium that you need, which is really the power mineral for the thyroid. And lastly, in the United States, we don't usually have an iodine deficiency because our food is highly salted and there's a ton of iodized salt in our diet. But you may increase your natural intake of iodine by eating sushi once in a while with seaweed or adding a baked potato to your meal. All right, so if iodine is not the cause of low thyroid in the United States, what is? In the United States, the #1 cause of low thyroid is autoimmunity. What does that mean? It means your immune system is attacking your thyroid. There is no deficiency. We're overfed. We have lots of food. It's not the problem. Scarcity isn't the issue. Unfortunately, abundance is the issue. Too many environmental chemicals, too much stress, too much sedentary behavior, too much toxic load. So all of the abundance of things that come into the body causes the immune system to get fired up. And unfortunately, the thyroid is a magnet for environmental chemicals. And so we have this genetic predisposition for autoimmune conditions, and then we have environmental toxic load that causes the perfect storm of an immune response that causes us to produce antibodies against the thyroid, which causes our immune system to slowly eat away at the thyroid gland, causing it to completely fail over time. So our traditional medicine approach when we see somebody with low thyroid in the United States is to just give them thyroid medication and call it a day. But you may want to consider getting the actual thyroid antibodies tested to make sure that's the cause of your problem, and then work towards improving your immune system through gut health, through toxin reduction, through stress reduction, finding chronic illnesses to help repair the damaged immune system and maybe preserve your thyroid gland if you catch it early enough. So part of your lab workup should be thyroid antibodies. For low thyroid, it's antibodies like TPO and TG antibodies. And for high thyroid, it's antibodies like TSI. Okay, so there are different antibodies depending on what's going on in your thyroid gland. So here's a picture of all the things you need to think about if you have an autoimmune thyroid condition. You could have an overgrowth of bacteria that's unhealthy or inflammatory in your gut. You can have leaky gut. You could be exposed to chemicals or had exposure like I probably had with my history of thyroid cancer. Living in the Midwest and the Farm Belt, probably exposed to a lot of things in the air. What else could there be? There could be chronic infections. We know that COVID has been associated and long COVID has been associated with autoimmunity, especially thyroid disease. Certain nutrient deficiencies can cause autoimmunity, especially vitamin D, immune dysfunction, emotional stress. So many things could be potentially the cause of the autoimmune crisis. Yes, Giovanna, absolutely. SIBO, IBS. IBS is linked to SIBO a lot of times. So SIBO is small intestinal bowel overgrowth. So an overgrowth of bad bacteria that's pro-inflammatory can really disrupt the immune system. And I don't know if you know this, Giovanna, but 70% of your immune system resides in your digestive tract. 70% of your immune system lives in your gut. So if you're eating foods that you're sensitive to, if you have leaky gut, if you have an overgrowth of bacteria, if you have imbalances in your gut flora, all of these things can trigger an inflammatory response in the body. And for people that have a genetic predisposition to autoimmunity, they can develop thyroid disease, but not just thyroid disease. You can have celiac disease, you can have alopecia where your hair falls out, you can have vitiligo where you lose pigment from your skin, you can have rheumatoid arthritis or lupus. So oftentimes, all autoimmune diseases start with dysfunction of the immune system. We kind of target and focus on the thyroid or on the skin or the hair, but the problem is not the thyroid. The thyroid is the victim. The immune system is the attacker, right? So we don't want to destroy the thyroid gland. We want to protect it from the immune system, and we want to figure out why the immune system is triggered and why it's attacking your thyroid. So that's the way I approach autoimmunity with my patients. So I mentioned that the thyroid is a chemical magnet. And we know that because during times of war, when there was potential nuclear attack, we were given these iodine pills to take. People would go into bunkers. They would take their iodine pills to protect their thyroid from radiation. So we know that industrial chemicals, phthalates, plastic products, heavy metals that are in the air because the industrial pollution. We know particulate matter has a lot of chemicals in it, like exhaust fumes and smokestacks, radiation from EMF towers, pesticides that are sprayed on our crops. All of these things in multiple studies have shown that it's linked to thyroid cancer and thyroid disease. Now, it's not just the stuff that's outside our home. It's also the stuff that's inside our home that's causing us disease. So if you're eating a lot of packaged processed products, if you're putting a lot of skincare, makeup, body care, perfumes that have parabens and phthalates in it, if you're drinking out of plastic water bottles and you're increasing your plastic load, if you're putting a lot of chemicals in your home cleaning supplies, all of these things over time have a stacking effect on the thyroid receptors on the cell, on the hormones that transport the thyroid into the cell, right? The proteins that transport it, and also the production of the thyroid hormone. So you do want to make sure that if you're suffering from an autoimmune thyroid condition, that you are looking at your environment and starting to clean things up in your kitchen, in your bathroom, in your home. Okay. And they did studies on people that have autoimmunity, and they found that there was a higher prevalence of autoimmune diseases where people lived in polluted areas, maybe near petrochemical plants, high farming areas. Like I said, I'm from the farm belt, contaminated with organochlorine pesticides and PCBs. So here's what I suggest you do. We can only control what we can control. So first is start moving to cleaner products in your home. Makeup, lotions, perfumes, body care, detergent, what you put in your dishwasher, what you put in your laundry, right? Try to filter your water if you can. Try to eat as clean as you can. If you don't know what to look for to substitute, there are lots of apps these days where you can put in laundry detergent and it'll tell you which one's clean, like Skin Deep from the EWG does that. Think Dirty is an app you can take to the store and say, I need a new shampoo. It'll tell you which brand to buy that's clean. Of course, I recommend having a healthy lifestyle, not putting chemicals in our body through smoking, vaping, alcohol, substances. Also having good lifestyle. Go to bed on time, work on your stress, right? Make good choices when you're at home. And lastly, if you're not sure what's causing your autoimmune disease, you may want to work with an integrated functional doctor to try to find out if you have any chronic illnesses, if you have environmental toxins in the body, if you have gut issues and dysbiosis and SIBO, like we talked about earlier, that might be triggering your immune problem. Because it's not a thyroid problem, it's an immune problem. All right, so now you say, okay, what's the third reason why I might have low thyroid? It could be a completely normal response, okay? Let me just explain this. Your body is an intelligent organism. When you are stressed, when you are in the ICU when you're sick, or you've had surgery, or you've been doing too much intermittent fasting and you've been starving, the body thinks, oh my gosh, I need to slow down metabolism because we can't burn through all this energy. We need it to heal. So then your body does this funny thing. It takes your thyroid and it squirrels it away for a rainy day. And that makes you feel like you have low thyroid symptoms. And then you go to the doctor and they check a TSH and they're like, yep, you have a high TSH. We need to put you on thyroid medicine for the rest of your life. But what if it was temporary? What if once you got done with the hospitalization, or you got better from the surgery, or you repaired the infection, that the thyroid goes back to normal, but you've been put on thyroid medicine for the rest of your life because of that high TSH? So how do you know that this is not temporary? You check something called a reverse T3. If the body is doing this on purpose to save you, you're going to see a high reverse T3. That's telling us that the body is actually doing this on purpose and that once you get better, your thyroid is going to go back to normal. So how many of you have heard that for the first time? That during illness, during stress, during starvation, heavy workouts, your body may actually start to shut the thyroid down to conserve energy on purpose. And if you reverse the causes, the infection, the kidney liver problems, maybe injury, surgery, that your body will go back to normal, just has to be monitored. That often doesn't get done. So treat the reversible causes. Thank you, Mary. Yes, it's very unusual for people to hear about this, but this is an important message. So the body does this thing, again, it conserves energy in response to stress and illness. And when you have high levels of cortisol, it blocks the conversion of T4 to T3. It pushes it to reverse T3 in the storage form. So what do I do as a functional doctor? I look for chronic stress, inflammation, illness, infection. I'm not reactive. If somebody's going through something tough, I follow that TSH. Oftentimes in the outpatient setting, a patient in the hospital will be put on thyroid medication because they ordered a TSH and it was out of range. And then I see them in the clinic and I'm like, why do they even check it? You're sick. Of course your body's going to have a high TSH. Let's recheck it again and see if it's back to normal before we give you a lifelong, prescription for thyroid medication. So how many of you are going to get a reverse T3 checked? You should. Now let's talk about another myth. Oftentimes in my clinic, I'll ask, and patients will say, isn't taking natural thyroid medication better than a synthetic pill? How many of you feel that way? My answer as a medical doctor is it depends on the person. Some people who don't convert T4, the thyroid hormone that the thyroid makes, to its active form, free T3, we might want to give them natural thyroid. Why? Because this is a hormone made from pig thyroid, and it has a little bit of a different balance when it comes to T4 and T3. Pigs have a little bit more T3 than humans. So sometimes natural thyroid is not right for everyone. It can be a little hard to regulate. The other thing is the consistency of T4 and T3 in each thyroid pill can be different, right? So if they're harvesting thyroid glands from pigs, you might get a grandma pig and a baby pig and a male pig. And so the composite of the hormone pill may not be the same from pill to pill. So that can create a lot of variability. So it's not always the best solution, though it is sometimes right for the right person. Now I have something to say about the synthetic pills. I take a synthetic T4, a branded one. Why? Because it's standardized, it's easy for me to manage, the dose is always the same every time. I seem to tolerate it just fine. I seem to convert to T3 just fine. So I don't really need to take a combination of T4 and T3. It's not really needed for everyone. You do need to be worried about gluten because a lot of the thyroid medications do have additives and gluten in it. So if you are sensitive to it, you may want to switch to a gluten-free brand called Tyrosint, okay? Now, the best way to take your thyroid medication, as I mentioned before, is on an empty stomach at the same time every day. Try to wait 30 minutes to an hour before you have breakfast or take your medications or other supplements. Now, if you choose to take it at night before bed, which is perfectly fine, just make sure that it's been 3 hours since dinner or any meals or anything else that you've taken, including medication.